2 Kenyans announced to have recovered from COVID-19 have gained some immunity against the virus, doctors said yesterday. A doctor who oversaw the treatment of Brenda and Brian, however, said it is not clear how long such immunity could last. As such, Brenda, who was known as Patient 1, and Brian, Patient 2, will need to practice social distancing and take precautions like every other Kenyan. Dr. Achieng Ombayo, head of the Infectious Diseases Department at the Kenyatta National Hospital, said most people who test negative after coronavirus infection remain negative. But we're not sure if you get lasting immunity. We expect that people develop immunity, but we're not sure for how long, she said yesterday after Brenda and Brian had a teleconference with President Uhuru Kenyatta. Ombayo said even with the experience of other countries, it remains unclear whether people who recover from COVID-19 will be immune to reinfection, and, if so, how long that immunity will last. Dr. Joseph Aluich, a veteran respiratory and infectious diseases specialist with more than 50 years of practice, says recovered patients definitely gain some immunity. In principle, yes, it does confer some immunity. But for how long we don't know, Aluich told The Star. Smallpox infection confers 100% immunity, flu is limited immunity, but for COVID-19 we do not know how long. It is just 3 months after the first case was reported, he said. Professor Peter Doherty, an Australian immunologist and the 1996 Nobel Prize winner in Physiology of Medicine, also recently said reinfection with coronavirus is unlikely. I would think even if it was reinfection, that your prior infection would give you very rapid immunity and you would recover very quickly, Doherty said. Doubts on immunity to coronavirus arose in late February when a woman in her late 40s who had been discharged from hospital in Osaka, Japan, tested positive a second time. More worrying was research from Guangdong province in China that reported that 14% of recovering patients had also retested positive. But scientists theorize that reinfection is unusual unless someone's immune system was not functioning right. They should also practice social distancing, Dr. Ombayo said yesterday. We have done repeat testing and we have discharged them. There's been a very strong team of health workers who have managed them and they have done well. This is a disease that can be controlled. Most people get very mild symptoms and do well. Don't stigmatize one another and follow the instructions given on social distancing. Brenda, 27, said she traveled to the United States last year, landing in Texas on December 19. When I finished my stay, I went to Chicago and during a layover had interaction with people. I took a flight to London, and that's where I think I was infected,